The virus that causes COVID is adapting. That's what Omicron is. It's a new variant, and we need to adapt also. Omicron is spreading very rapidly, astonishingly quickly. You've seen cases in New York City more than triple in just a short period of time. It's more like a flash flood than a wave. And in order to avoid having COVID continue to dominate our lives, there are a few things we need to do. Vaccinate and boost. Mask and mask up. If you're older or immunosuppressed, get an N95. And balance what we do. Balance what we do as individuals and balance what we do as a society. As individuals, if something's really important to you, do it, but do it as safely as possible. And we need to keep businesses growing, airplanes flying, schools teaching, and most of all, our healthcare facilities safe and operational, and we need to save lives. And we can do that by balancing, because what's clear with Omicron is that you're very infectious for a day or two before you even feel sick, very infectious for a day or two after you begin to feel sick, and after that, not very infectious at all.
But shouldn't they have, or why didn't they say that you should have a negative test after 5 days before going back to work, or that you have to be vaccinated fully after 5 days before going back to work? Those are some of the points that other renowned doctors, like Dr. Vin Gupta was on yesterday and reacted. He was a little confused as to why unvaccinated after 5 days wouldn't still be contagious.
Frankly, I think the biggest problem here isn't the recommendation. They're sensible recommendations. They tread a careful line. They're based on science. They're always going to be judgment calls. We always wish we knew more than we know when we have to make recommendations. And you always are going to be making recommendations before you have perfect data. What bothers me most, actually, is that CDC didn't have a news conference. So people are saying, why did they do it? And there are good reasons for what they did, but they haven't been able to explain that clearly. I don't know why CDC isn't having regular news briefings from Atlanta, not just with Dr. Walensky, but also with the subject experts who've been working on this all through the Christmas holiday. And they've got a good reason. Now, for example, if you required testing to get out of isolation, are you going to have enough tests? Which tests would you require? The PCR test can be positive long after someone is no longer infectious. Would people not get tested in the first place if they knew they would have to get tested to get out? So in the end, would you do more harm than good? And ultimately, how much of the transmission are you going to stop by doing that versus how much benefit will you have by getting people back in school, back at work, and avoiding having our hospitals not have the staff they need to take care of people when they're sick?
Dr. Frieden, despite these sort of rampant cases at the moment, I wonder whether there's one big positive to take from all of it, which is that surely the chances of lockdowns from here are very, very minimal. I mean, you could look at that on the positive side of immunity rising across the country, but also the negative side of countries like France just reporting a record daily case number, despite much more stringent measures, sort of showing that they don't really work anyway.
Well, people are certainly tired of them. Vaccination, boosting, and masking are small things to do that can prevent overwhelming our healthcare system. We're still seeing more than 1,000 unvaccinated Americans dying each and every day in the U.S. And the key is to ramp up vaccination, boost, and mask. A big unknown is how much hospitalization and how many deaths will there be from this Omicron wave. We know that it's going to blow through all prior records for case numbers. The highest average daily case count was 250,000. Omicron is going to go above that within a short period of time. The average top number of new hospitalizations per day was 16,000, new deaths 3,500. We hope Omicron won't come anywhere near that because it may be milder, particularly in people who have been vaccinated or had a prior infection. But only time will tell. And you can't take back what you've done now. So better safe than sorry. Vaccinate, boost, and mask up, and balance what you want to do. If it's important to you, do it, but do it safely.